Many people believe that emotional wellness should be a regular part of a medical checkup. Under a grant from the New York State Office of Mental Health, there's a program available for parents to get an emotional wellness checkup for their kids. Here to tell us about this new program is Dr. Max Banilivy of Pederson-Krag. Dr. Banilivy, thanks so much for joining us today.
Thank you.
Great. I guess the best place to start is talk about emotional wellness and how it applies to kids.
It applies very much the same way as it applies to adults, and that is an overall way of the person has of managing their behavior, their feelings, and their health, and ways to enhance it.
Mm-hmm. And the early recognition screening program is the grant that your agency and FEGS received. Talk about that.
It's a free program for all families across the state, where parents can choose to do these screenings, which are paper and pencil based, on all their kids that they may be concerned about, or they may just want to find out more about. And basically that information, that questionnaire will be scored, feedback will be given to the parents, and then the parents can decide if there are any kind of other services they need and how to access them through our help with linking them to those entities.
Okay, so parents bring their child to a health clinic or a practitioner, and they have the early recognition screening, and they do the test. Does the clinic or the doctor do the scoring, or do they send it to Pederson-Krag or FEGS?
This is completely confidential and involuntary, and if they do that and that doctor's office is participating, what happens, they send all those forms confidentially to us. We do the scoring, and we get back to every single family that has completed a form. And so if a parent has completed a form on 4 of their children, we'll score all 4 and get back to that parent and talk about every single child.
So it really represents a partnership between the mental health field and the medical practitioners.
Yes, that's intended to be. In fact, this is where we're all going, basically trying to take a look at the whole person, in this case to try to look at the whole child, from infancy all the way to 21 years of age, to be able to look at their overall functioning and all aspects of development, whether it be physically or emotionally.
And what are the advantages of identifying emotional issues that a child may have at an early point?
Well, we know that behavioral and emotional issues, when they have been there and they've been complicated over time, they're much more difficult to attend to. So we want to prevent complications, and we want to address any issues as early as possible, because it's simpler to attend to, and we can be much more successful and effective in addressing them.
So after the screening is received by your staff, as you said, they get back to each and every family. And what kinds of services are offered?
It all depends on its wide range, and in many cases may not even be behavioral health services. It could be a lot of concrete services, could be a lot of supportive services, could be parent education, could be support groups that are available. So we have, our staff are aware of many resources in the community, so they have it at their fingertip. So whatever the parents need, we can help them link to those services.
That's great. I a lot of parents watch this show, and I'm sure a lot of them are wondering, that sounds like a great idea. I'd really like to have my children screened. How would they go about doing that?
They can contact Pederson-Krag at 631-920-8039 or 8000, or they can simply talk to their pediatrician or health professional otherwise and say, do you have the early recognition program here? If not, we're more than happy to work with those professionals and implement it and set it up for them.
So that'd be a great thing, in a sense, to advance things. If parents started asking for this and kind of said to their medical practitioner, this is something you should offer. It really is good for all of us. You know, one of the sayings that a lot of people in mental health have is that without mental health, there's no health. And that sounds like a large part of what you're saying, that mind and body are very much connected and we need to address the whole person.
Exactly. Exactly. That's really the intention of it, along with being a preventive early recognition program.
Dr. Banilivy, thank you so much for joining us today. It sounds like a great program.
Thank you for having me.
Great. Thanks.